What's up? Doc Mike. Public Health on Call. By Johns Hopkins Bloomberg School of Public Health. Today's topic for March 15, 2021. Vaccines and the Future of the COVID-19 Pandemic with Peter HOTEZ. Thank you, Johns Hopkins Bloomberg School of Public Health.
Good morning and welcome to a live episode of Public Health on Call. My guest today is Dr. Peter HOTEZ. He is at the Baylor College of Medicine, and he can talk to us today about vaccines, vaccine hesitancy, and a whole host of other COVID-related topics. Dr. HOTEZ, thank you so much for joining me.
Thanks for having me.
So I want to start with COVID vaccine rollout. It has really been a bit of a disaster in many places, and I'm wondering if you can help us understand a little bit about why.
Well, it's getting a little better, but we've only, on average, vaccinated around 15% of the American population with a single dose. I would have hoped we'd be a little further along by this point. Some states are doing better than others. Here in Texas, because we lost a week due to the terrible power grid failure, we're at the bottom, around 12%. States like New Mexico, Alaska, over 25%, so they're doing much better. But overall, the progress has been a bit disappointing, and it has to do with a few things. One, I think the system for vaccinating adults, we never really had a system in place. We don't, as I often like to say, half jokingly, half sardonically, we don't really have a health system. We have Amazon Pharmacy. We don't, we have the pharmacy chains who are doing the best they can. We have the hospital systems, but we don't really have a public health infrastructure for doing lots of adult vaccinations. Like most Americans, I get my adult vaccines like for Shingrix or Tdap booster or MMR through pharmacies, and they just don't have the capacity for high throughput. So that's slowly being fixed now. The other problem is the supply of vaccines. I think one of the disappointments of Operation Warp Speed, we've been hearing all in 2020 about manufacturing at risk. That was the Warp Speed part. The Warp Speed part was that these vaccines were going to be ready to roll as soon as emergency use authorization, and now that's not the case for the J&J vaccine. That was just approved for release, or about to this week. We only have 3 to 4 million doses, which is basically a rounding error. It's nothing. I mean, remember the task at hand. We want to vaccinate, probably 85% of the U.S. population. That number has gone up since the emergence of the variants of concern because they're more highly transmissible. So we're talking 250, 300 million Americans times 1 to 2 doses. We're looking at 500 million immunizations. We have to do that and as quick as possible, and not having J&J vaccine in hand is a disappointment. And then communications around vaccines has not been great. We still have about a third of Americans, adults, saying they're going to refuse COVID-19 vaccines even if they're made available. And that's a consequence of failing to stand up adequately to the anti-vaccine lobby, which now dominates the internet. So we still have a lot of work to do. No question, things are better and moving in the right direction. I think by the summer or fall we're going to be in a much better place than we are now. But getting between now and then is my time that I'm worried. I'm worried about the month of March, April, and May until we can get that mother load of vaccines in place. We can convince more people to get vaccinated, and doing this ahead of the variants, which now look like they're starting to accelerate.
I was going to ask about vaccine hesitancy. I know that research actually done by some folks I work with at Johns Hopkins has said that only 65% of people in the U.S. say they'll get a vaccine. I mean, that is nowhere near what we need to stop this pandemic, is it?
That's right. Well, if you look at with the increased transmissibility expected from the B.1.1.7 variant, which is expected to be dominant soon, I think, before we published a paper with Bruce Lee, who used to be at Hopkins and now he's at City University in New York, and we came up with 60 to 80% of the population would need to be vaccinated to slow or halt transmission. But now I think with the variants of concern, that number goes up to more like 80-85%. And so that means probably most or all of the adult population needs to agree to be vaccinated, even adolescents and kids. And so that's a pretty high bar. I mean, I think things will get better as people feel more comfortable about it. But, we published a study. I'm not a social scientist, I'm a vaccine scientist, but we collaborated with a group from Texas A&M, a group of social scientists led by Tim Callahan. And what was interesting about the qualitative study, and quantitative as well, looking at who was more likely to refuse getting vaccinated or is hesitant, it came out with the same two groups that an earlier survey from the Kaiser Family Foundation found. And the fact that we used two different methodologies came to the same result, I think is kind of interesting. It makes me think that it's real, that it's not just some aberrant study. And the two groups are very different. It was both of our number two groups in terms of frequency of refusing vaccine were African American populations and Black communities. And number one is what we called Trump voters, what they called Republicans, so people in the conservative right. So, I mean, talk about very different dynamics there, conservative groups versus African American population. So I've been trying to understand that a little bit more, and we could talk a little bit about historically how those two lines of vaccine hesitancy unfolded.
Well, I'd like to ask you about sort of this whole concept of hesitance. I know you are leading, I believe, a Lancet Commission on Vaccine Refusal, Acceptance, and Demand. Talk to me a little bit about what your goal is there, and whether you feel that this sort of whole anti-science element is going to be a hindrance.
Yeah, I mean, and I'm co-chairing this with my friend and colleague Saad Omer at Yale, and who's worked a lot with people at Hopkins like Dan Salmon and others. And Dan is really important for us as well. Yeah, I think the goals are to really understand. First of all, the anti-vaccine movement has evolved. It's gone through ebbs and flows across American history, but its most recent iteration started up in 1998 with the publication of the fake paper by Andrew Wakefield and his colleagues in the Lancet. But it really accelerated in the U.S. around 2015, and that's when it politicized and linked to political extremism, especially on the far right, and they started forming political action committees like Texans for Vaccine Choice. So fully understanding the dynamics and what the anti-vaccine movement, how it's evolved, because it's not the same today as it was 5 years ago, and certainly quite different from what it was 10 years ago. So we'll talk about how it's different, and then finding ways to launch a counteroffensive and what needs to be done there. Mm-hmm. So if you need, the way I see this evolving, the anti-vaccine movement is kind of scary. What's happened? It really accelerated in 2015, very much linked to this concept of health freedom, medical freedom, especially it started, I think, in Orange County with the closure of the non-medical exemptions around the measles epidemic there in 2014, 2015, but quickly moved to Texas and Oklahoma, Western states, where, again, under the banner of health freedom or medical freedom, people tied their political allegiance to counteracting public health interventions under health freedom, medical freedom. So this is when PACs formed, Texans for Vaccine Choice, Oklahomans for Vaccine Choice. And then you started to see national anti-vaccine groups form, like Children's Health Defense under Robert F. Kennedy. And these groups were better funded and better organized than anything we'd ever seen before, and they quickly began to dominate the internet, and the social media groups really enabled it. And Amazon was a big problem and is a big problem. Amazon is right now probably the single largest promoter of fake anti-vaccine information. If you go to, and anybody can do this while you're listening to this, you can do it on your computer. Go to Amazon.com. you go to look at the little menu up at the top where you go to books, and every American has done that, right? But you press return, you'll get a scroll down menu at the left. You go down halfway to the page to health, fitness, and dieting. Click on that, then you'll get another scroll down menu that lets you click on vaccinations, books on vaccinations, and you'll see they're pretty much all fake anti-vaccine COVID conspiracy books. So Amazon is actively engaged in promoting, as is all the social media companies. So how you address that? The other thing that's happened though in 2020 is really scary. One is what was an anti-vaccine movement has now expanded to protests against masks and social distancing, especially in the southern states in the Midwest, mostly red states, and including where I live. So it's what was an anti-vaccine movement is now a full-on anti-science movement. It's not just vaccines anymore. And then the other twist and turn to this is what happened in Western Europe last summer. So that same anti-mask, anti-vaccine, anti-science initiatives that are now widespread in the U.S. Globalized to Western Europe. And so you started seeing protests in Trafalgar Square in London, in Paris, in Italy, in Berlin. They actually stormed the Reichstag. It was an anti-mask, anti-vaccine program. They stormed the Reichstag, the German parliament. Not too different from what happened in the U.S. Capitol 2 months ago. And then the New York Times and BBC reported it was linked to QAnon and other right-wing extremist groups. And then on top of that, you've got the Russians. You've got, according to U.S. and British intelligence now, you have the Putin-led government launching a whole systematic program of weaponized health communication. And, if you go to my Twitter feed, you see it all the time. And so a lot of that's coming out of Russia. So, what was homegrown political smaller political extremist groups like Texans for Vaccine Choice coming out of Texas or related groups in Oklahoma is now a full-on global anti-science movement. And I'm hoping our Lancet Commission can kind of get to the bottom of that. And I've certainly been writing a series of articles now about it. And this has become a new activity of mine, going up against anti-science groups. And it started when I wrote the book, as they call it, Vaccines Did Not Cause Rachel's Autism, about my daughter. And then Robert F. Kennedy Jr. amplified it by attacking me, calling me the OG villain, which I had to look up, the original gangster villain. So you're hearing from the original gangster villain today. And then, during my cable news appearances, when I, trying as best I could to stick to the science, but when you saw the deliberate disinformation unfold beginning last March into April, when they were attributing when the Trump White House Coronavirus Task Force was attributing COVID deaths to other causes, or discrediting masks and social distancing, saying it was a hoax or the flu, or saying the hospital admissions. Remember, you had Kayleigh McEnany saying hospital admissions were due to elective surgery. This was and it wasn't just the president, right? It was the whole White House Coronavirus Task Force. It was people like Larry Kudlow and Mark Meadows and all those guys. It was a full-on coordinated anti-science disinformation campaign. And I was one of the first to call that out, not because I'm such a brilliant guy, but because of years of being the OG villain going up against the anti-vaccine movement. I can now smell an anti-science disinformation campaign a mile away, and I did, and called it out there. And it was really stressful. It was a tough time. It's still a tough time, but that's what we're up against now. So when we talk about vaccine hesitancy, I try to make the case that it's much bigger than that. It is an anti-science confederacy or anti-science empire. And then I'll shut up in a minute and let you ask a question. But I'll just read one last point that we can follow up, which is, and then you have to be careful how you say that, because if in one breathless sentence I start talking about QAnon in extremist groups and the Putin Vladimir Putin and the Russians, you yourself start sounding like someone who throws things at the TV at night. So, but now you sort of get it, and it has some credibility to it. But it's not a 30-second UNICEF commercial. It takes time to kind of explain it all.
So tell me this: why do you think COVID has been worse in the United States than anywhere else? I mean, we're number one in COVID deaths and cases. So why has that happened?
Well, as I point out, it had a number of origins. Well, one is some common features to the virus itself. I mean, the fact that you have this Janus face of the virus, right? Half the people being asymptomatic, and another significant portion becoming hospitalized, going into ICUs. That was a very unusual combination of that asymptomatic virus shedding from the nose, mouth, and throat. But so even under the best of circumstances, that's a tough virus to contain. But then I think the other two pieces were, one, this refusal by the federal government to launch a COVID-19 response, a federal response. There was this insistence the states would be in the lead and the federal government would provide backup support. That was a failed strategy. It was doomed to fail from the beginning. But then there was the disinformation campaign, and in time, one tied your political allegiance to whether or not you believed in the disinformation. In other words, to show loyalty to the Trump administration, you had to not wear a mask, and you had to dismiss social distancing. And, then you had that whole fake Great Barrington garbage that came out there. So this became a problem, that it wasn't just the virus, it was the virus with political defiance. And by the way, it wasn't actually even unique to the Trump administration. You saw this with other authoritarian / populist regimes. This was true with the Bolsonaro regime in Brazil, and Daniel Ortega coming out of Honduras, and Duterte in the Philippines. You also had that defiance or dismissal. And then, of course, the spectacularizing of hydroxychloroquine, which went along with that. So,
of course, those countries don't have this kind of outbreak that we've had.
Yeah, pretty bad, but you're right. So I think it was those two big elements. It was the COVID-19 and the deliberate defiance of public health control, which we're still seeing today. And you've got, and a lot of the governors of the red states, were insist, they kept on using these fake terms, no lockdowns. And we weren't talking about a lockdown. What we were saying is, in places where you were going to get a big surge on your intensive care unit, slow things down a bit to give the hospital staff a chance. And yet they would reframe it as this dichotomy and this defiance, and it killed 500,000 Americans as a result. I mean, we would have had loss of life no matter what, but I think we could have halted the surge across the southern states in the summer. I think we could have done a lot to delay the big fall surge that we had in going into January. And I can't tell you how many lives we could have saved, maybe at least half or more.
So cases are down right now, and the ICUs are much emptier. Are we in sort of having this false sense of security at this point? Is this just sort of the lull before the storm with variants on the rise?
Well, whether or not we get a storm depends on how quickly we can vaccinate. I feel pretty confident that by the summer and into the fall, we're going to be in a much better place as we move towards this aspirational goal of fully vaccinating the American people. So we'll be in a much better place. And now we just learned that 2 doses of the vaccine not only does it save your life and keep you out of the hospital or ICU, now the studies in Israel are showing it halts asymptomatic transmission, or 92% reduction. So, and the other vaccines will probably do the same. So they're halting virus shedding from the nose, mouth, and throat. That's huge, right? So that means that in time, I think, as we move to the fall, maybe we'll no longer require masks for people who are vaccinated. We'll be able to open up sporting events and restaurants. Quality of life is going to be really good again. I don't know if they'll be completely normal, but really good. That's the good news. The bad news is we're not vaccinating as quickly as we need to right now because we don't have the supply of vaccines, and we still have a lot of hesitancy, or refusal. So how many more lives we lose really depends on what happens in March, April, and May, and that's going to be the tough time.
Yeah, I'm ready and willing to get a vaccine whenever I become eligible. I understand that you will be traveling, I saw. So tell me a little about that. You've been vaccinated?
I've been vaccinated. My wife's been vaccinated, and one of my oldest adult daughters has been vaccinated. She works for a health center. And then two of my adult kids have had COVID, unfortunately, recently had COVID. So I think that'll be okay. I haven't seen them in my two oldest adult. I have two oldest adult kids in 14 months. So, you reach a point where vaccinated, their risk is low. So we're gonna hopefully we'll be together for a weekend anyway. And
yeah. So you're gonna get on an airplane.
Get on an airplane. You have been on an airplane, and the last time I was on an airplane, I know exactly when. It was exactly a year ago, because I testified to the House Science Committee, and I flew to Washington. I think it was on March 5th. So I think it'll be exactly a year.
Yeah. So how does that feel to you, knowing sort of what we've been through? Is there any fear of risk? I mean, how do you feel?
For my personal safety, I feel pretty good with the fact that I've been vaccinated, and those 2 doses of vaccines are pretty powerful, right? 94% protection against symptomatic illness, 92% protection against asymptomatic infection if the data from Israel holds up. So yeah, I think that's good. I mean, we're gonna have, we're never, I hate to use the word never in biological science, we're unlikely to ever reach a point where we're gonna have zero risk, right? So, but I think if you're vaccinated, and if the people you're seeing are vaccinated or recently infected, preferably vaccinated, but recently infected is almost as good. It's about as, that's stacking the deck as much as you can and having a safe visit. Mm-hmm. And it's not going to get much better than that, right? So even in the fall, right, when everybody's, let's play this out. Let's say everybody's fully vaccinated by the fall. The risk of transmission is still not going to go to zero, but we'll be in a far better place, particularly since the vaccines seem to do really well against the UK variant, the B117. Mm-hmm. And, you talk to people like Trevor Bedford at University of Washington, an expert in virus genomics, genomic evolution. He thinks it's more likely the UK is going to become dominant. If the South African one revs up, the vaccines will be less effective, and we'll need boosters. I think we're going to need boosters anyway, so those will come in time as well. So the bottom line is I have some optimism that we will be able to vaccinate our way out of this. There will continue to be complexities and wrinkles. For the U.S., I'm not. I'm more optimistic. I'm very concerned about Africa right now, especially sub-Saharan Africa, because the B1351 variant coming out of South Africa is more resistant to vaccine and to the current vaccines, and it's accelerating now into Malawi and Mozambique and Zambia, and that really gives me cause for concern, because Africa's done overall pretty well in 2020, better than I would have expected, but I'm worrying if Africa's time has come now with this new South African variant. So because we develop COVID-19 vaccines, we're working furiously. Now we're not only producing a vaccine for the original strain, we're starting now to produce our vaccine for the B351 variant, which will hopefully get a lot of the other variants of concerns.
Mm-hmm. And will I be able to, will I be getting perhaps an annual COVID shot? And like I get an annual flu shot? Is that the future?
It's possible, but I don't think so. I think what'll happen is this eventually will, the 2 mRNA vaccines will move to a 3-dose vaccination, meaning you get your two doses of the original, then a booster. later on for a slightly reconfigured one for likely the South African variant or something similar to it. J&J will probably move to a 2-dose vaccine for similar reasons. And the hope, and if that provides long-lasting, durable protection, you may not need another vaccine for a long time. And that's the unknown. We still don't know durability for any of these vaccines. But I don't think we're going to move to an annual vaccine like flu where we reconfigure it each time. It's not impossible, but I'm, given what I'm seeing in terms of the convergence of the variants, I think that probably won't happen. And there's not consensus by any means in the scientific community. So you talk to people like Bill Hazeltine, they think these variants are, the virus will continue to evolve and continue to mutate in different and unexpected ways, so that we may need to move to a more regular system, but we'll see.
So one quick last question before I let you go. Could you talk to me about what you think is what will we take away from this? What lessons will we learn for the next time?
Yeah, I think, some of the lessons learned is we put a lot of energy and resources into nuclear deterrence. We put a lot of energy and resources into fighting terrorism. We put a lot of energy and resources now into fighting climate change, and all those things are worthwhile things. I think we have to give equal measure now to pandemic threats, and we're always trying to do this on the cheap and always in a very reactive mode. It's not that we're doing nothing. I mean, things have gotten better with each pandemic. I mean, after SARS in 2003, people like David Heyman and others put forward the International Health Regulations, IHR 2005. After H1N1, we put together the Global Health Security Agenda and influenza surveillance. After Ebola in 2014, there were 2 annual meetings at Davos in 2016, 2017 around creating CEPI, the Coalition for Epidemic Preparedness Innovation. And each time we took a step towards pandemic preparedness that we hadn't had previously. And a lot of the thinking around that came out of Johns Hopkins, right? With what D.A. Henderson and Tara O'Toole started, and now continuing with the Johns Hopkins Center for Health Security and others. So there's a lot of good things have happened, but I think this one is so dramatic in terms of this COVID-19 pandemic, in terms of its ability to collapse the global economy and disrupt global security on a level we haven't seen before, that I'm hoping there will be some other quantum changes in our ability to accelerate vaccines and look at how we could have improved things. I mean, I think one of the things that I saw that I'm disappointed is we went pretty heavy on the innovation, and which was a good thing, right? We've got mRNA vaccines and adenovirus vaccines for North America and Europe. But when you look at the landscape of what's available for Africa, for instance, it's not a heck of a lot out there. Hopefully our vaccine can come through. So despite well-intentioned efforts around creating COVAX, which is a good mechanism, we just don't have those durable people's vaccines, as sometimes we call them, like we should. So hopefully we'll be able to fix that and bring in greater involvement with the development.